Have you had gastric bypass, or do you know anybody who had gastric bypass? Then this video is for you. I have a lot of patients who have a history of gastric bypass who come to my clinic because of different neurological issues. More commonly than not, they'll have a severe fatigue or brain fog or very severe peripheral neuropathy. Gastric bypass sometimes is required as a life-saving procedure, but unfortunately it's a barbaric procedure. It destroys your function of your gastric tract forever, and it's not reversible. You always will have maldigestion or decreased digestion of all the proteins, fats, and carbohydrates. You also will have a considerably decreased absorption of all the B vitamins that are vital for our body. In this video, I would like to show you an example of severe damage as relates to patient who came to me with severe brain fog and fatigue, and unfortunately had a gastric bypass in the past. You can see on this picture below that patient has a very significant dysfunction of her GI tract. She has significant spillover of metabolic dysfunction from the dysbacteriosis. She also have very considerable dysfunction in a fungal overgrowth in her gut. Then, when we look at her energy production, we have a very clear explanation why she feels like she is. She has severe fatigue and severe brain fog because her mitochondria does not work properly. And on the next picture, you can see that all her B vitamins are dysfunctional. She has basically no markers that are normal that shows that patient's mitochondria will not be able to work properly because it does not have cofactors that are important. In addition to that, she has a very considerable issues with detoxification that also will impair mitochondrial function. And last but not least, she has a significant malabsorption of all elemental markers, all the minerals that are cofactors for our mitochondria to function properly. So without that knowledge, it would be impossible to figure out what needs to be done for the patient to help her to achieve her optimal health. Please share with others, follow me for more. I will be showing you a lot more studies and a lot more explanations of what needs to be done for those patients.